A breath holding spell is an episode in which the child involuntarily stops breathing and loses consciousness for a short period immediately after a frightening or an emotionally upsetting event or a painful experience. Breath holding spells are usually triggered by physically painful or emotionally upsetting events. Typical symptoms include paleness, stoppage of breathing, loss of consciousness, and seizures sometimes. Despite the dramatic nature of the symptoms, these spells are not dangerous. Tantrums. Tantrums, often a component of breath holding spells, may be prevented by distracting the child or avoiding situations known to trigger these spells. Breath holding spells occur in less than 1% to about say 5% otherwise healthy children. They usually begin in the first year of life and peak at 2 years of age. They disappear by the age of 4 years in 50% of the children, and by the age of 8 in approximately 83% of the children. A small percentage of these children may continue to have these spells in adulthood also. Breath holding spells can be categorized into two forms. One is the cyanotic blue form and another is the pallid pale form. Both the cyanotic blue form and the pallid pale forms are involuntary, which means that the children are not intentionally holding their breath and have no control over the spells. Involuntary breath holding spells are easily distinguished from the uncommon brief episodes of voluntary breath holding by some children. Children who voluntarily hold their breath do not lose consciousness and go back to their breathing normally after they get what they want, or after becoming a bit uncomfortable when they don't get what they want. Despite the frightening nature of the episodes, children do not have dangerous or long-term effect. Parents must try to reinforce the initiating behavior. At the same time, parents should not avoid providing appropriate structure for their children out of fear because of causing spells. Distracting children and avoiding situations that lead to tantrum are the best ways of preventing and treating these spells. A doctor may recommend iron supplements for a child who has cyanotic breath holding spells even when the child does not have iron deficiency anemia, and the treatment of obstructive sleep apnea is also required if the child has this difficulty. Breathing starts, unconsciousness return without any treatment. Because this form of symptoms are similar to those of a heart disease or a brain disorder, the doctor may need to do diagnostic evaluation to rule out those disorders, and if the spells continue to occur very often. Thank you so much.